Mastering high-yield pharmacology concepts is crucial for success on the USMLE Step 1. A strong grasp of core principles, such as mechanisms of action and pharmacokinetics, provides a solid foundation for understanding how drugs work in the body. Familiarity with major drug classes and their clinical uses helps in recognizing patterns and making informed decisions. Additionally, knowing essential side effects is vital for identifying potential complications and ensuring patient safety. This comprehensive approach not only aids in exam preparation, but also supports effective clinical practice. Pharmacokinetics describes how the body handles a drug through four main processes: absorption, distribution, metabolism, and excretion. Absorption refers to how a drug enters the bloodstream, while distribution describes its movement to various tissues. Metabolism, often occurring in the liver, can significantly reduce drug concentration before it reaches systemic circulation, a phenomenon known as first-pass metabolism. Excretion is the process by which drugs are eliminated from the body, primarily through the kidneys. Clinically, factors like albumin binding are important, as drugs bound to proteins may have reduced activity and altered distribution, impacting both efficacy and safety. Lipophilic drugs are compounds that dissolve easily in fats, rather than water. Because of their fat-soluble nature, these drugs tend to accumulate in body tissues and are not readily excreted by the kidneys. To facilitate their elimination, the body must first metabolize these substances, typically converting them into more water-soluble forms. This metabolic transformation is essential, as it allows the drugs to be efficiently removed from the body through urine or bile. Without this process, lipophilic drugs could persist in the system, potentially leading to prolonged effects or toxicity. Pharmacodynamics explores how drugs interact with the body to produce their effects. Agonists are substances that bind to receptors and activate them, mimicking the action of natural compounds. In contrast, antagonists bind to receptors but block their activation, preventing a biological response. Partial agonists activate receptors but produce a weaker response compared to full agonist. Additionally, competitive inhibition occurs when a drug competes with another molecule for the same binding site, while non-competitive inhibition involves a drug binding to a different site, altering receptor function regardless of the presence of other molecules. Cardiovascular drug classes play a crucial role in managing a wide range of heart and blood vessel conditions. Common high-yield classes include beta blockers, which reduce heart rate and blood pressure by blocking adrenergic receptors, and ACE inhibitors, which lower blood pressure by inhibiting the renin-angiotensin system. Diuretics help eliminate excess fluid, easing the workload on the heart, while calcium channel blockers relax blood vessels to improve blood flow. Each class has distinct uses and potential side effects, such as electrolyte imbalances with diuretics or cough with ACE inhibitors, making careful selection and monitoring essential in clinical practice. Beta blockers are a class of medications that primarily work by slowing the heart rate and lowering blood pressure. They achieve these effects by blocking the action of certain hormones, such as adrenaline, on the heart and blood vessels. Clinically, beta blockers are used to manage conditions like hypertension, angina, arrhythmias, and heart failure. However, important side effects include bradycardia, which is an abnormally slow heart rate, and the potential to mask symptoms of hypoglycemia, particularly in diabetic patients. Understanding these risks is crucial when prescribing beta blockers, as careful monitoring is needed to ensure patient safety. ACE inhibitors are a class of medications primarily used to manage high blood pressure and heart failure. They work by blocking the angiotensin-converting enzyme, which reduces the production of angiotensin II, a substance that narrows blood vessels and increases blood pressure. Additionally, ACE inhibitors increase levels of bradykinin, a peptide that promotes vasodilation. Notable side effects include hyperkalemia, or elevated potassium levels, and angioedema, which is swelling that can affect the face and airways. Understanding these features helps guide their safe and effective use in clinical practice. Calcium channel blockers are a class of medications commonly used to manage high blood pressure and certain heart conditions. They are divided into two main types: dihydropyridines, or DHPs, and non-dihydropyridines, known as non-DHPs. DHPs, such as amlodipine, primarily act on the blood vessels, causing them to relax and lower blood pressure. In contrast, non-DHPs like verapamil and diltiazem have a stronger effect on the heart, reducing heart rate and contractility. Understanding these differences is important, as DHPs are typically preferred for hypertension, while non-DHPs are often chosen for arrhythmias or angina, but may not be suitable for patients with certain heart conditions. Antibiotic classes are distinguished by their mechanisms of action and characteristic side effects. Beta-lactams, such as penicillins and cephalosporins, inhibit bacterial cell wall synthesis and may cause allergic reactions. Macrolides, like azithromycin, disrupt protein synthesis and are associated with gastrointestinal upset and potential QT prolongation. Fluoroquinolones interfere with DNA replication, but can lead to tendon rupture and photosensitivity. Aminoglycosides target protein synthesis as well, with notable risks including nephrotoxicity and ototoxicity. Understanding these differences is crucial for selecting the appropriate antibiotic and monitoring for adverse effects. Aminoglycosides and macrolides are two important classes of antibiotics, each with distinct mechanisms of action and potential side effects. Aminoglycosides work by binding to the bacterial 30S ribosomal subunit, inhibiting protein synthesis and leading to bacterial cell death. However, their use is often limited by adverse effects such as nephrotoxicity, which can impair kidney function, and ototoxicity, potentially resulting in hearing loss or balance disturbances. Macrolides, on the other hand, target the 50S ribosomal subunit to halt bacterial protein synthesis. A notable risk associated with macrolides is QT interval prolongation, which can predispose patients to serious cardiac arrhythmias. Fluoroquinolones are a class of broad-spectrum antibiotics widely used to treat various bacterial infections. They work by inhibiting DNA gyrase, an essential enzyme that bacteria need to replicate and repair their DNA. By blocking this enzyme, fluoroquinolones effectively prevent bacterial growth and survival. However, their use is associated with significant risks, including an increased likelihood of tendon rupture and potential damage to cartilage, particularly in children and older adults. These serious side effects have led to careful consideration of their use in clinical practice. Central nervous system drugs encompass several important classes, each with distinct mechanisms and clinical uses. Benzodiazepines act by enhancing the effect of the neurotransmitter GABA, leading to sedation and anxiolysis, but they can cause drowsiness and dependence. Antidepressants, such as selective serotonin reuptake inhibitors, work by increasing neurotransmitter levels to alleviate symptoms of depression, though they may lead to side effects like weight gain or sexual dysfunction. Antipsychotics are primarily used to manage symptoms of schizophrenia and bipolar disorder by modulating dopamine pathways, but their use can be associated with movement disorders and metabolic changes. Understanding these drug classes helps guide safe and effective treatment of various psychiatric and neurological conditions. Endocrine pharmacology focuses on medications that regulate hormone levels in the body. Insulin is essential for managing diabetes, as it helps lower blood glucose by facilitating cellular uptake of sugar. Metformin, another key drug for type 2 diabetes, works by decreasing glucose production in the liver and improving insulin sensitivity. Glucocorticoids are widely used for their anti-inflammatory and immunosuppressive effects, but they can cause side effects such as weight gain, osteoporosis, and increased risk of infections. Understanding the mechanisms, uses, and potential adverse effects of these medications is crucial for safe and effective treatment. Respiratory pharmacology focuses on medications that help manage conditions like asthma and chronic obstructive pulmonary disease. Beta-2 agonists work by relaxing smooth muscle in the airways, leading to bronchodilation and improved airflow. Anticholinergics, on the other hand, block the action of acetylcholine, reducing airway constriction and mucus production. These drug classes are commonly used to relieve symptoms and prevent exacerbations in respiratory disorders. Understanding their mechanisms and clinical applications is essential for effective patient care. Heparin and warfarin are two widely used anticoagulant drugs in hematology. Heparin works by enhancing the activity of antithrombin, which inhibits clotting factors in the blood, while warfarin acts by blocking vitamin K-dependent synthesis of clotting proteins. Monitoring is essential for both medications. Heparin is typically tracked using the activated partial thromboplastin time, or a PTT, whereas warfarin requires regular checks of the International Normalized Ratio, or INR. In cases of overdose, specific antidotes are available. Protamine sulfate can reverse the effects of heparin, and vitamin K is used to counteract warfarin. Understanding these mechanisms and monitoring parameters is crucial for safe and effective anticoagulant therapy. Chemotherapy agents are designed to target rapidly dividing cells, a hallmark of many cancer types. By interfering with cell division, these drugs aim to halt the growth and spread of tumors. However, because some healthy tissues, like those in the bone marrow and hair follicles, also divide quickly, they can be affected as well. This often leads to side effects such as bone marrow suppression, which can reduce blood cell counts and hair loss. Understanding these principles helps explain both the effectiveness and the challenges associated with chemotherapy treatments. Certain medications are associated with distinctive high-yield side effects that are important to recognize. ACE inhibitors commonly cause a persistent dry cough and can lead to angioedema. Amiodarone is notable for its effects on the thyroid, lungs, and skin, including pulmonary fibrosis and photosensitivity. Statins may result in muscle pain or weakness, known as myopathy, and rarely, rhabdomyolysis. Vancomycin can trigger red man syndrome, a histamine-mediated reaction characterized by flushing. Clozapine carries a risk of agranulocytosis, a serious reduction in white blood cells, requiring regular monitoring. Remembering pharmacology can be challenging, but using simple memory aids can make a big difference. For example, to recall the side effects of anticholinergic drugs, think of the phrase hot as a hair, dry as a bone, blind as a bat, red as a beet, and mad as a hatter. For beta blockers, the mnemonic ABEAM helps you remember the selective agents atenolol, betaxolol, esmolol, acebutolol, and metoprolol. Associating drug classes with vivid images or catchy phrases can help cement these facts in your mind, making exam preparation more efficient and less stressful. Understanding drug mechanisms, their primary uses, and at least one major side effect is crucial for effective test preparation. This foundational knowledge not only helps in answering exam questions accurately, but also builds a strong base for clinical decision-making. By focusing on these key aspects, you can better retain information and apply it in practical scenarios. Remember, a clear grasp of these essentials will serve you well both in exams and in real-world medical practice.